Good afternoon, lecturers, staff of the Faculty of Medicine, Silirat Hospital, and other university guests. My name is Tasaniya Ratanarithanoparat Jamjamrat from Silirat Health Science Education Excellence Center. On behalf of the center, we are all here to welcome David John Wortley, FRSA, to be a speaker on the topic impacts of technologies on health science. Let me introduce our speaker for a while. David graduated from the United Kingdom with a degree in electronic and electrical engineering. He used to work with IBM, HP, and the University of Putra, Malaysia. He is Vice President of the International Society of Digital Members. His area of interest are wearable technologies, artificial intelligence, and gamification. Before we start, on behalf of the Silirat Health Science Education Excellence Center, I would like to disclaim any conflicts or benefits that might happen during this seminar. It is not our intention to support any commercial materials or programs. We focus on the knowledge you might gain from the seminar only. David, the time is yours.
Okay, thank you very much, Kay. It's nice to have a nice introduction. I'd also like to reinforce that conflict of interest. You may see some examples of commercial applications during my presentation. It's not intended that these are in any way meant to endorse those products. They're just intended to be examples of what is possible through technology. And there may be one or two surprises in the presentation, but I hope that all these surprises will be relevant to the topic that I want to talk about. So I'll begin by sharing my screen. I start my slideshow presentation. Okay, so I'll begin again. My name's David Wortley. I'm a fellow of the Royal Society of Arts, and it's my pleasure to be able to talk to you today. I want to just run through the agenda that I've got in mind. I want to begin by showing a welcome slide. Now, as my friend Kay will know, I don't speak Thai, so I had to use an avatar to make my welcome introduction for me. I only know Swadee Krap and Kompu Krap, so that's the limit of my Thai. I do apologise for that. If you go away with anything else today, the most important slides are going to be the slides about the big picture, which explain what is happening with technology in general and the impact on all our lives, because we are going through an extraordinary time in history. So these 4 slides explain the magnitude of the changes that are happening today and how they will affect medical science. I'm then going to focus on some examples of how these disruptive technologies are impacting particularly nursing education, but medical science in general, which will leave time for some questions and answers and discussion amongst yourselves to try and absorb this first part. Then I want to have a short break. I've said 10 minutes, but 5 minutes may be adequate before I go on to the second half of the presentation, which looks at another disruptive technology and how that will affect medical science, in particular health and well-being, again followed by a question and answer. And if time allows, and I don't think it will actually, I do have some exercise which gives some thoughts about how technology is affecting all of us and the importance in the future of humanity. So here is my welcome to you in Thai. I hope it's understandable. It was partly generated by AI, but it was checked by a human Thai and edited so that it was more understandable. I'd be interested to hear your reaction to this.
สวัสดีครับผมขอแสดงความยินดีต้อนรับทุกท่านเข้าร่วมการสัมมนาออนไลน์ครั้งนี้เรามีความยินดีและภูมิใจที่ได้รับเกียรติจากท่านอย่างยิ่งใหญ่คือเดวิด วอตเลย์รองประธานสมาคมสากลของการแพทย์ดิจิทัล ที่มีประสบการณ์และความเชี่ยวชาญในการนำเสนอเรื่องเทคโนโลยีและวิทยาการแพทย์ในการสัมมนาครั้งนี้เราจะมาอบข้อมูลและความรู้เกี่ยวกับผลกระทบของเทคโนโลยี AI Artificial Intelligence VR Virtual Reality และ Metaverse ต่อสายงานด้านสุขภาพซึ่งเป็นเรื่องที่สำคัญและน่าสนใจอย่างยิ่งการใช้เทคโนโลยีเหล่านี้มีศักยภาพในการเปลี่ยนแปลงวิธีการให้บริการทางการแพทย์และการดูแลสุขภาพอย่างล้ำลึกเรามาพร้อมกับความกระตือรือร้นที่จะแบ่งปันความรู้และประสบการณ์ใหม่ๆกับทุกท่านและหวังว่าความรู้ที่ได้รับในวันนี้จะมีประโยชน์และสร้างแรงบันดาลใจให้กับทุกท่านดังนี้ขอเปิดเสวนาต่อไปโดยการนำเสนอโดยเดวิด วอตเล่รองประธานสมาคมสากลของการแพทย์ดิจิทัลท่านจะได้รับข้อมูลที่มีความหลากหลายและน่าสนใจเกี่ยวกับเทคโนโลยีที่กำลังเปลี่ยนแปลงวิธีการให้บริการด้านสุขภาพในยุคปัจจุบันขอขอบคุณทุกท่านที่มาร่วมสัมมนาออนไลน์ครั้งนี้และขอให้ทุกท่านมีประสบการณ์ที่มีคุณค่าและเติบโตไปพร้อมกับเทคโนโลยีและวิทยาการแพทย์ในอนาคตขอบคุณครับและขอให้ทุกท่านมีความสุขในการเรียนรู้เดวิด วอตเล่รองประธานสมาคมสากลของการแพทย์ดิจิทัล
It would be useful to me if you could put into the chat whether that was good, okay, or terrible, so that I get some sort of feedback on the quality of the use of AI to animate my avatar and produce a talk to you in Thai. So I said at the beginning that these are probably the four most important slides that I have in my presentation. And I've called them the big picture slides, and I want to try and illustrate how the power of technology has changed exponentially within my lifetime. Now, this could have been a picture of me, except that I had a moustache in 1984. And this was the type of computer that I used in 1984. It had 640 kilobytes of main memory. It had a slow processor. It had a color screen, which had 200 by 320 pixels and a maximum of 4 colors. And it cost £3,000, and it could really only do word processing and account. So back in 1984, these types of computers had no medical science capabilities whatsoever. Compare that to today, where we have had an exponential change in the power of technology. And today, the device that I use for some of the special effects that I'm showing today was not done on a computer. Well, it wasn't done on a computer. The computer is my iPhone 13. And the specification of my iPhone 13, I have 1 terabyte of storage, which includes the main memory and also the disk storage. It has an incredibly fast processor. The display quality is enormously impressive. And we don't just have 4 colors, we have true tone displays. And today, this will cost me around £1,000 in the UK, which is actually equivalent, allowing for inflation, about 10% of the cost of the computer that I used in 1984. So what does this mean? Well, in my lifetime, or in fact the last 40 years, computers have become over 1 million times more powerful. And unlike the ones in 1984 that needed some expertise to be able to use, this was before Windows, so there was no graphical user interface. Today, they can be used by anyone. And they have many, many, many medical applications, whether it is a desktop computer, a laptop, or a mobile phone. All of these have a wealth of medical applications. And unlike the computer in 1984, which really wasn't connected to anything, they can communicate with the world in seconds. They can also record video and photos, which my computer in 1984 could not do. And they can display information in richer ways than were ever possible in 1984. And they are increasingly affordable. So there's been this massive change in the power and performance, But there's also been a massive change in the usability of these technologies. So in 1984, the technologies that were available to the medical profession were very specialized, like X-ray machines. They were very expensive and still are very expensive. Many of the devices that you will see in hospitals, MRI scanners and the like, are still very expensive. In those days, they required expert training. So you, as a radiologist, you would spend years training how to use the technology to be able to interpret the results. They were not connected, and in many cases even today, they're still not connected. And analyzing the data it was relatively complex. So again, we've had this exponential change in usability. In 1984, you need specialists or experts to be able to operate technology. In 2024, a lot of these devices are consumer devices. The iPhone 13 is a consumer device that can be operated by non-expert people, including children. And this represents a massive change. So to summarize, these are now consumer technologies. They're very powerful, they're affordable, they require minimal training, they are connected to the world by default, and you can analyze and visualize data much more powerfully and easily than you could in 1984. So again, what does this mean? Well, technology is much easier to use today than it was 40 years ago. And it's got many, many medical applications. It can be used, and it's important for the future of your careers. It's important to recognize that technology now is much easier to be able to monitor personal health, particularly with wearable devices. Intelligence is accessible from anywhere. In other words, in 1984, the information you could access was only that on your desktop computer. Today, through World Wide Web and through search engines and AI, you can access information from anywhere around the world. The accuracy of that information may be questionable, but it is accessible from anywhere. And knowledge and opinions can be shared globally. My presentation that I'm doing today could be watched by anyone in the world if they had the correct link and permission to access this webinar. So now I set the scene for the big picture. And just to say to you in summary, the world has not only changed enormously over the last 40 years, it's changing faster and faster. And this will affect medical sciences increasingly quickly. Some of the things that I've shown you today, including my avatar speaking Thai, I could not have done only a year ago. And next year, you will see even greater changes as we progress with the development of these technologies. So when we're looking at AI and VR in medical applications, this is how I want to structure it. I want to look at the fact that this is something that is not essentially completely new. I want to show you some examples of the early days of the use of AI and VR in medication. I want to talk about what the good news is and the fact that it is important for the medical, particularly the nursing profession. I think there is some good news to share with you in that respect, in the impact of technologies. I asked ChatGPT what it thinks about the impact of AI and VR on medical education. I'm going to share with you what ChatGPT thought about it, show you some examples of AI and VR in nursing, just say a few words about the effect of COVID and how this has accelerated the impact of technology in medical sciences, and just reflect a little bit on some of the challenges that we faced as a society, particularly with the increased longevity of people and the problems of the aging society, what this means for medical professions, and then go on to some examples of preventative healthcare and digital therapeutics before summarizing and concluding. So I said I wanted to share some examples of the early uses of AI and simulation technologies in 2007. And this was just about the time when I started with the Serious Games Institute as their founding director. And in those days, the computer games industry was pioneering some very advanced uses of technology for medical education. And what this company did, it's a company called Blitz Games. They're based in the UK, and they're one of the largest independent video games companies in the world. And they produce many consumer, what they call AAA games. These were very powerful video games that you would play on video game workstations, not on your phone or on your desktop computer. So they decided that there was a big opportunity to be able to use these computer games technologies for purposes other than entertainment. And so they began by seeing what they could do with medical scanner. And so they did a 3D scan of the head of one of their graphics designers. He also happened to be called Dave, same name as me. And they used this to try and animate this person to be able to simulate emotions and also to be able to simulate realistically the impact of injuries. So it was a test to see how the AI and simulation technologies of the day, and it's 17 years ago, could be used for medical education. So I will just play this video to you. And what you're seeing here is how they were using this 3D scan and placing or making marker points on the person's head. And through the use of these sliders, they could show the head expressing different kinds of emotions. And you'll see for 17 years ago, that's really quite realistic. And this is how they use that same technology to show students what a dying man would look like. Somebody suffering from a head wound, a fatal head wound. And you'll see on the left-hand side, the person in their normal state, and on the right-hand side, you'll see, pardon me, how that state changes over a period of 60 seconds. So this man is going to die in 60 seconds, and this is what you will be likely to see. So the way the blood flows, the pulsing of the arteries in his neck, the sweat, the color of his face, all of this is generated by linking to medical data, and it's designed to help people understand or to experience situations that hopefully they would not experience during their lifetime. So that was an example of 17 years ago of creation of avatars from 3D scan data. But there are some other examples I just wanted to share with you. And the example on the screen now is a computer game, if you want to call it that, a simulation to train paramedics how to deal with an explosion in a city centre. And the city centre happens to be a place called Leamington Spa, which is where this company Blitz Games was developed. So you can see the scenario there, and then they use that scenario in a video game to train paramedics to deal with different kinds of casualties. So here is an example of a casualty. There are several casualties in the street. and the paramedics had to use this game to triage the patient. So it's extremely important when you're dealing with a significant number of casualties to be able to accurately triage them so that you can give attention to those people who can be saved and who need immediate attention. And you can either identify people who need attention, but it can be delayed, identify dead people, and so on. This is an example of an early simulation of a medical ward that was developed by a college in London. And at the bottom of the screen, this is also an interesting project which was designed to train junior doctors to deal with different kinds of symptoms of people from different ages and different ethnic background. And the idea was that you could create an avatar of any age, any ethnicity, any gender, and then you could give that avatar the symptoms of a particular condition. And in a training exercise, junior doctors could examine that person interactively and come up with a diagnosis. So all of this was being explored 17 years ago. So that may be surprising to some of you. It may even be before some of you were born, or certainly when you were very early children. This is one of the surprises, and I do hope I don't offend anybody. In the 5 minutes or 10 minutes before we started, I took the liberty of taking a screenshot of people at your university and making avatars of them. So on the left-hand side, you can see how that picture was transformed into wearing a suit with a background of London. And the picture of my friend Kay was actually not taken this morning. It was some time ago taken from one of her Facebook photographs and given a medical uniform. So the point I'm trying to make here is that AI and VR are likely to benefit the nursing profession substantially, and I'll go into explaining why. And before I do, though, I want to express my own personal view, and that is that AI as a technology is a two-edged sword. It has enormous potential to support humanity, but it has an enormous threat to the future of humanity. AI used irresponsibly and maliciously, because it is so powerful and because it is accessible to anybody, can be extremely damaging. But particularly in the nursing and medical profession, it's very important that AI is used to support human values and to ensure that the roles that are adopted by nurses and doctors are not replaced by artificial intelligence. Artificial intelligence is actually used to supplement the qualities of human beings. So I asked ChatGPT, a free version available on the internet, what it thought about the impact of artificial intelligence on nursing education. This is what it came up with, and I asked it to give me academic paper references. I haven't checked these, so I don't know whether they're accurate, but it does warn you to check any reference. So first thing, it has the potential to revolutionize nursing education by providing personalized learning experiences. In other words, it recognizes that everybody is not the same, and it has the ability to provide real-time feedback to students. And AI-powered virtual tutors can offer 24/7 support to nursing students. And the example of me talking in Thai is an example of how you could create an avatar linked to a knowledge base to support nursing students any time of day or night, and allow them to practice at their own pace. AI in nursing education can also increase students' engagement and motivation, leading to improving learning outcomes. Now, I didn't come up with these quotes. It's ChatGPT provided these quotes for me. It just happens that I agree with all of these quotes, and this is how I see technology changing your lives. And this is about the impact of AI on nursing roles, not education, but nursing roles. And AI has a potential to augment clinical decision-making and diagnostic skills of nurses. So this is very important. And this is one of the things that will impact the roles of nurses in the future, because nurses, with the support of technology, will be able to take on higher level of decision-making and diagnostic roles. And this can only benefit patients in the long run. It can also help to reduce the workload and burnout by helping with some of the decision-making, reducing some of the administrative burden, can help to reduce the pressure on nurses, allowing them to focus on higher level tasks. And finally, it can provide nurses with real-time access to patient data, allowing them to make more informed decisions and provide better care. And again, these are quotes that ChatGPT came up with that I happen to agree with entirely. And virtual reality. I'm going to be showing some examples of virtual reality as we go through the presentation. And the main thing is that VR can provide nursing students with immersive, hands-on learning experiences that simulate real-world patient scenarios. So just as you saw the early example from 2007 of someone dying from a head wound, today with virtual reality headsets, you can simulate a whole range of real-world patient scenarios that are very realistic with a virtual reality headset or even a computer screen. And the use of VR can also help students develop clinical reasoning and critical thinking skills in a safe and controlled environment. This is very important, is that within medical education, nursing education, it's important that nurses operate in a safe, both from a nursing and from a patient perspective, and a controlled environment. And it can also provide students with interactive and engaging learning experience that are less stressful and more enjoyable than traditional methods. And again, these are not my words. This is what ChatGPT came up with. And again, I happen to agree with those. So looking at AI and VR in nursing, these pictures are not pictures that actually exist, and not photographs taken from real life. These are generated by AI, and in this case, they're generated using a PhotoLeak mobile application. So I told it what kind of picture that I was looking for, and it came up with that picture. Today, even in the few months after I created this slide originally, things have advanced even further. And there are now even more powerful tools available on the web for you to create images and videos from your imagination simply by describing what you want to see. So it doesn't access stock photo libraries. These are created on the fly. So technology has changed nursing roles, responsibilities and practices, and I've tried to explain the reason why that is, and it's primarily because technology is so much more powerful, much more accessible, so much more usable than it was 40 years ago. And importantly, the sensor technologies that are available to monitor people's vital signs and apply diagnostics to changes in those vital signs, they're improving constantly so that people's medical condition can be monitored in real time, not just in a hospital environment, but also when people are recovering from home. So technology is empowering, but it also means that it's going to disrupt long-established practices. So what it means is that jobs and tasks that previously were the domain of doctors and consultants because of the knowledge that they had in their brain are now being shifted towards nurses and other staff supported by technology in the form of mobile devices and a range of other tools. So it means that nurses are going to take on roles that were previously done by, if you like, higher qualified people who'd had many years of medical education to be able to do their work, now can be done by people who have less training but are supported by technologies like AI and VR. And here's just an example of a surgical application, just to show you the way in which things are moving and the significance of these technologies. On the left-hand side, you'll see what you might describe as a traditional operating theatre with people performing an operation on a person. In the middle, you see someone simulating laparoscopic surgery. So in other words, using the laparoscopic devices linked to what amounts to a serious game, the person on the screen there is removing a gallstone. So she is seeing what a surgeon would see doing the operation with the laparoscopic tools. Now, the point about this picture is that this picture was taken not in hospital, but at an exhibition in Kuala Lumpur, where medical technology was being shown off. So this is probably about 7 years ago. And the person doing this laparoscopic surgical operation is not a nursing student, it's my partner, Jackie. She has no medical training. She's really not a computer games person at all. The only skill that she had that she could transfer to laparoscopic surgery is that she used to do a lot of needlework and sewing in her younger days. But it's interesting to note that even without this computer game background, even without any medical knowledge, she was able to perform this removal of a gallstone, and her skill was evaluated in terms of the time that it took to remove the gallstone and the damage that she caused by lack of skill in using it. So it's use of computer game technology to train surgeons for laparoscopic devices. And despite all of this lack of background, she was producing results that were better than some junior surgeons. So it makes you think how technology could be used to enhance and supplement human skills for people who are not necessarily fully trained in the way that we've become used to. And in the case today, on the right-hand side, you can see a robotic surgical device. And these are becoming increasingly common because of their accuracy and the lack of damage that is done through the use of these types of technologies. So amazing changes within a short space of lifetime. And of course, I'm not sure whether you use these at Mahidol University, but the use of holography and virtual reality devices can disrupt the way in which people learn about anatomy and different types of medical condition. So these are the key disruptive technologies that we're talking about here. Artificial intelligence and machine learning. Now, these are changing day by day. As I said, we're going through a period of exponential change. The rate of change is increasing rapidly. And today we have a lot more wearable device and biometric devices. Now, I've been using wearable devices for the last 10 years to monitor my own personal health and to try to do something about managing my health by better understanding the influence of things like exercise, diet, hydration, what you might call lifestyle medicine factors. And biometric devices, and not just wearable devices, but increasing there will be embedded devices and devices that are like skin patches that are able to accurately measure the vital signs of your body and provide this information so that when a doctor or a nurse does a diagnosis, it is not just done on a single one-shot measurement. It can examine the vital sign data over a period of time. 5G and broadband technologies are extremely important in enabling this, and I'm able to talk to you today because even though I'm in a house in the countryside, it's not exactly remote, but I live in a small village, but I am connected by fiber broadband. So I am able to talk to you and share my presentation because of these technologies. And of course, we have smartphones and a range of mobile applications that are getting increasingly rich. We have virtual reality and simulation technologies that are extremely important in helping people to experience and train in increasingly realistic but safe environments. And we have the Internet of Things, where all of these sensor devices are connected and come together to provide a more complete picture about a person's health. So looking at the impact of COVID-19, I was actually in China in the month before COVID-19 was announced to the world. So in October 2019, I actually traveled through the city of Wuhan, or went through Wuhan airport a month before it was recognized that COVID-19 had hit the world. And what COVID-19 has done has really accelerated this digital revolution, because it's forced medical science to use technology and the most powerful technologies available to find ways of developing new treatments and new solutions to combat this terrible virus. So the impact of COVID-19 on patient care, I'm sure you're all aware of these, but it's restricted physical contact in a way that has been used and has been necessary in medicine over a number of years. It's created an increased demand because of this for telemedicine and remote care, so that people can be cared for and can be monitored without necessarily having physical contact, without necessarily being in a hospital. And it's also accelerated the use of consumable wearables to monitor patients. And it's improved the accuracy and clinical validity of these consumer wearable devices. And it's brought in an era of personalized healthcare through the use of artificial intelligence and epigenetics. And in my case, I've actually just started using a new solution in the UK called Zoe. And Zoe is a kind of package which involves the use of a blood sugar monitor in your arm. It involves the use of a device which will take a blood sample and it involves taking a sample of your stools. And this is used to analyze your gut health, your blood sugar response, and your blood health. And by doing this, and by monitoring and recording what you eat each day and seeing the impact on blood sugar and blood health and gut health, it is able to give you advice on diet that will give you a healthier life. Now, I've only been using this for about 3 weeks now, but in that time, I've learned a lot more about kinds of foods that affect me positively and negatively. And although it wasn't an objective of mine to lose weight, I've already, in the space of 3 weeks, lost about half a stone. Not intentionally, just by eating some of the food which is more healthy for my body. But it's also, COVID-19 has also emphasized the need to be able to shift from a medical profession, medical sciences that are based on curing things, to medical sciences that are preventing these things happening the first time, and creating, certainly in the UK, a much more integrated approach to care services. So in future, technology is going to be used increasingly for remote patient care. So the care of people in ill health, particularly with people with chronic conditions, is likely to shift away from hospitals into homes and communities, enabled by these technologies used for medical science. But it's also important, as I mentioned right at the beginning, these technologies are used with proper human empathy. So it's okay for, and in fact beneficial in many cases, for a person to be looked after and treated at home. But it's important that they are treated in a humane way and not forgotten about simply because they're not in a hospital ward. And there are many different ways of doing this. And here is an example of a nurse or a clinician providing advice remotely on physical exercise. So moving on, as I said in my agenda, to the Aging Society Challenge. This is one of the biggest threats, I think, to the future of medicine or the sustainability of public health services. And these are the issues which you, as students, are likely to face increasingly in your career. So the good news is that we are living longer, but the bad news is that we are living longer, but in poor health, and also in many cases in social isolation, because of the way in which society has evolved from families living together throughout their whole life, to families becoming separated and dispersed so that children move away from the family home. When people die, there are a lot of people on their own living in social isolation. And the challenges of smoking and obesity. Okay, smoking has been addressed to a certain extent with some of the measures taken by government, but obesity is really a serious problem. And of course, people want to stay in their homes as they age. Older people are more likely to fall. And so there are a whole range of issues related to the aging society, and medical science needs to find ways of addressing these challenges. And this is kind of exemplified by this example of my mother. This is a picture of my mother in Kettering General Hospital. She was rushed to hospital from the care home that she was in, suffering from severe dehydration. She nearly died, but she is an example of what is happening to older people around the world. We're living longer, that is a good thing, but we need more medical care as we age. And sadly, because of falling rates of the birth rate in the population, there are fewer working people to cover the costs of caring for older people. And the care for the elderly has shifted from family homes to care homes. Years ago, or in my previous generation, my mother would have been looked after by a family. Today, because families dispersed, my mother had to be cared for in a care home. And elderly care is a poor relation of public health services, and coronavirus has had the impact of exposing our vulnerability to the increased costs and the unsustainability of public health services. And this is something in the UK that is becoming a serious problem. So what this amounts to in terms of medical science is that we need to use technologies that help to provide care in the community through technology-enabled partnerships and relationships between all of the stakeholders affected and impacted by technology. And we need to make this transition from cure to prevention. And the quote at the bottom of the screen is from Sir Simon Stevens some 7 years ago when he became the head of the National Health Service, and he described obesity as being like a slow motion car crash. And he recognized that the only thing we could do to address this is adjust our personal lifestyle behaviors, and to do so as early as possible. So what this means for you in the nursing profession particularly is that instead of necessarily or as well as providing care for people suffering from chronic condition, you will have a role of using technology to coach people on how to better manage their own health so that they become less likely to require medical attention. And these are some of the digital technologies and digital therapeutic that will be increasingly used. And this is an example of a wearable patch that it will be designed to monitor vital signs on a patient, and it won't be a smartwatch. It will be something like a patch that you will have on your body that can not only monitor your vital signs in real time, but also communicate via smartphone to provide alerts to medical professionals so that you can provide early intervention and prevent some serious problems. But digital technologies are also being used for digital therapeutics as alternatives to drugs. And these are some examples of the use of, it's a device that's a 360-degree projector. So it's like having a virtual reality headset without having the headset. You are immersed in an environment which can take not just one person, but many people to beautiful places around the world, can help them experience things like a roller coaster ride, which is what's shown in the middle picture, or show them relaxing environments underwater. And these kind of digital therapeutics can be used not just for physical health, but also for mental health and providing relaxation, reducing life stress. So these digital therapeutics that I'm talking about, it's important that they must empower humanity and empathy. They must not replace human beings. They must supplement human beings and provide added value to human beings, either in the accuracy of diagnostics or the level of care that our people are providing. And these solutions must provide a solution for both physical and mental health. And if people are going to be able to use them in their own home environment, and there are many examples of home-based solutions where people can do physical and mental exercises on their television set in their own homes, they must be plug and play. In other words, you need to be able to just switch the television on or the device on and be able to use it without any complex setup. And they must combine realistic challenges. It's no good giving people a challenge, an exercise challenge that they're incapable of, but they must do these realistic challenges that people are capable of with fun and enjoyment. And it's important that there are ways of connecting and engaging with the family and community so that people don't suffer from the same social isolation. So when they are trying to manage their own health better, they can have technology used to allow them to communicate and engage with the family and the community. And also provide for the medical profession, your future feedbacks and diagnostics that not only allow you to track your health, but also provide you with some motivation and give people control over their own health. To summarize this first part of my presentation, it's important to recognize that we were and we are in a period of exponential change, and COVID-19 has actually accelerated that rate of change, and it's accelerated the use of digital technologies like VR and education in medical science, in education and in health services. But these technologies are both empowering and they're disruptive. There will be what you might describe winners and losers with the use of these technologies. There will be some people who will be empowered and able to take on high-level roles, but there will be other people whose jobs are seen to be threatened by these technologies. And perhaps an example of that as a radiologist who previously would have required years of training to be able to analyze the scans and the displays that come from the devices they're trained on. Today, with AI and machine learning, the diagnostic accuracy of AI is now beginning to exceed what is capable of a human being. So that is a threat to the career of somebody like a radiologist. So ways of addressing them need to be found. Humanity and empathy must be paramount in all of this. Nursing, particularly nurses' roles, will change and they will upgrade, and probably nursing will be a much more fulfilling profession, hopefully in the future, because of technologies that enable, empower, and give them more control over the services that they provide to their patients. VR and simulation will help training, and digital therapeutics, use of these technologies to support rehabilitation, stress management, and preventative healthcare will become increasingly important. So now I'd like to ask if there are any questions, if they can be typed into the chat box. I'll just have a look at the chat box. Yes, I thank you very much for the comment about the avatar. The content delivery awesome. A few more pauses. Yeah, this is. I'm glad you've pointed that out, because this was the human contribution that I mentioned. As originally, I asked ChatGPT to give me a 3-minute welcome introduction in Thai, together with a summary of the impact of these technologies on medical sciences. And I used the text that it created in Thai to animate my avatar. And I have a Thai friend who lives in France, actually, and I sent the video over to her. And this is exactly what she said about there were not enough pauses. It was too quick, weren't any pauses. So I asked her to edit the Thai text for me, to add in some full stops and pauses in the text. So what you saw, what you heard, was actually the edited version. So obviously she hadn't, or the changes that she'd made didn't fully address the pauses that were needed. I did send the revised video to her to get her to check, and she said it was okay. But it's interesting that you make that because I don't know Thai, I can't speak Thai, I had no idea how it would come over to you. So I had to rely on a human being to enhance the AI technology to make it more understandable. So you can see perhaps how a combination of AI and human beings can be used to do things like this. And in fact, you could get. I used an avatar, one of my avatars, in Japan to speak Japanese to deliver my whole presentation, 20-minute presentation in Japanese with English subtitles. So I found it particularly useful. Are there any other questions before we have a little break?
David, I saw some comments in the chat box.
Oh, yes, I'm just looking at those now. Yes, yeah, sad voice and emotion. Yes, you're correct there, but there are actually some applications now which are designed to enable you to choose the emotion. And I'm not quite sure. I think it's called Human Pulse, but it is a web-based application where you can choose the type of emotion that you want some text read with. Facial expressions, again, that is something which you will see within the next probably year or so. And what you will also see is the use of avatars working in real time. So you'll be able to talk to your phone or your computer. You'll be able to ask an avatar questions, and that avatar will answer your questions in real time. So in other words, these are not things that are set up as I had to do. I had to process this text with an avatar, not in real time, but now it is increasingly possible with AI linked to medically validated knowledge bases to get avatars to answer questions in real time, very realistically. The cost effectiveness of VR, yes, this is yes, it's important. It's not just the cost effectiveness of VR, it's also the fact that virtual reality headsets are still not, in my opinion, fully suitable because of their what's called form factor. In my case, I don't like really wearing a VR headset because every time I take it off, it takes my glasses off. And so it's very annoying. There are some advances with the new Oculus Quest 3 and the new Apple augmented reality device, which are still very expensive. But these will become down in price. And so you'll be able to do things on these devices which will be more affordable, that it would cost you a lot more to do any other way. So that's where I see the cost effectiveness come, is it enables students and doctors to do much more at a lower price. The other impact of VR, I think, will come from these 360-degree projection devices that you can put into rooms, so that it's not just one person who can experience a VR situation, but a group of people in a room that doesn't require VR headsets. Thank you very much to Deidre as well. I hope you gained something from the session about how AI could positively impact healthcare and health science, including nursing education. So thank you very much for your questions and your feedback. I would now just like to suggest that you have a break. So again, this is a picture that I simply said, show me a picture of two of Thai nurses in a coffee shop having a coffee break. And this is what the program that I used, it's called Artistly.ai. It's a web-based program. It came up with this picture for me, which I think is a nice picture. But if we could have 5 minutes break and come back at what will be 10 minutes past 3 your time. I'm just going to take a little break myself to blow my nose, particularly. I'm getting, as you can tell, I've got a bit of a cold and a little bit blocked up. So I'll be back in 5 minutes. It's in the chat. Thank you. Thank you for the good wishes. Well, I've just got a hot honey and lemon drink, so I'm hoping that's going to help with the congestion. Right, I will continue. And the second of my presentation is to talk about a technology that I think is going to be increasingly important, and that is the metaverse. You may have heard a lot about metaverse, and I want to talk about it in the context of metaverse, in the context of health and well-being. So what has the metaverse got to do with health and well-being? How a particular metaverse transformed the life of someone that I knew some 17, 18 years ago. How a virtual reality game supported pain management. How the use of immersive games can also help to improve cancer outcomes in young patients. Talk about the metaverse and digital therapeutics. As I mentioned digital therapeutics earlier on, and the metaverse has some potential for digital therapeutics, and look at some physical health and rehabilitation applications, as well as mental health applications where the metaverse is used. So what has the metaverse got to do with health? Well, a typical view of the metaverse is what you see above there. You see avatars moving about in a virtual world. And so it's been described, metaverse has been described as a virtual reality space in which users can interact with a computer-generated environment and with other users. So the metaverse is not new. And in fact, the image that you see on the screen there was from a metaverse environment called Second Life, which was launched in 2002. So it's over 20 years ago. And in fact, although the metaverse is gaining a lot of attention at the moment, particularly with the money that Meta, or what used to be called Facebook, Meta, are putting into it, it is not just an environment that you use with a virtual reality headset, because virtual reality headsets didn't exist really 20 years ago, not consumer ones anyway. So these metaverse environments you experience on your computer screen. So you didn't have to have a virtual reality headset. You could explore these worlds, interact with other avatars on your computer screen in much the same way that people playing these video games like Fortnite do today. So what I'd like you to do is just reconsider the definition of the metaverse and think of it as an imaginary place that we've all been to. We've all created our own metaverses at different times in our life. Kids playing with imaginary friends, kids playing doctors and nurses. This is their virtual world, their imaginary world that they're playing in. But it's true in older people taking themselves to a special place, dreaming about a holiday that they've had or the holiday that they would love to have, or in a fantasy world as a young child, imagining scoring a winning goal in a cup final. So the metaverse is an imaginary place. And as I say, it doesn't have to be a computer-generated imaginary place. And we've all used the metaverse in these different ways throughout our life as a way of educating ourselves through learning, through play, as a way of helping our mental health through dreaming and relaxing about imagining ourselves being in beautiful places. And I can clearly remember when I was a child and I went to the dentist. Dentists in those days, they didn't use injections. They used air and gas. So you put on a gas mask, and basically you were anesthetized, so you were basically knocked out. Dentists don't do it today, but as a child, as a 5-year-old, having one of these masks put on and smelling this air and gas was a very frightening experience. So I remember the dentist saying to me, imagine that you're on a sunny beach and the sun's shining, you can hear the wave. So he was using this virtual world idea to help me relax and cope with the experience of having air and gas before he did some work on my teeth. So if we look at the physical world and the mental world, the virtual world, as opposite ends of a spectrum, we exist, and what is tangible to us and what you are experiencing today, listening to me, is a physical, it's real, it's tangible. You're conscious of listening to me, conscious of watching what I mean. And the physical world is measurable, but it's also, from a human perspective, limited to the physical characteristics of the world. We can't suddenly teleport ourselves to another space. We can only physically run at a certain speed. We're limited by our senses. So this is what we describe as reality. But at the other end of the spectrum, you can mean a totally virtual world. This is the place that we perhaps take ourselves to when we imagine beautiful experiences or beautiful places. It's intangible. Our brains create this, but we can't touch it. It's in our subconscious, and you can't really effectively measure it. And unlike the physical limitations of the world that we live in, it's unconstrained, and it's the power of our mind that takes us to these things. So the metaverse, you can regard as a kind of continuous spectrum that starts on one hand with reality, goes through augmented reality, extended reality, and then virtual reality. And games, simulations, and immersive technologies are the technologies that you take us on this journey from the physical world to this virtual world. And our physical and mental health are intertwined. So although we experience physical pain, and I'm experiencing congestion and blocked nose at the moment, my mental health is also intertwined with my physical health. If I've got a snuffly cold, then my mental health is likely to be affected. But if I am really positive in my outlook on life, and I'm having positive mental thoughts, I'm not depressed, then my physical health is also likely to improve. So the physical and virtual spectrum are very closely intertwined. So what has the metaverse got to do with health? Well, it creates a space free from the worries of the world. It's an environment that we can explore without many of the constraints of the physical world. So in other words, we can do things in the metaverse that we can't possibly do in the physical world. It also, because of this, gives us a sense of control and freedom. We're not constrained by the limitations of our body in the physical world. It can help with stress management and mental health issues. I'll show some examples of that. It can also provide a space and facilities to exercise. So if you are in a small apartment in a crowded city centre, the metaverse can provide a space which effectively allows you to exercise in an environment that feels like the countryside. It can also provide an immersive space to help you socialize with other people. And it could also, as I'm going to show you, help you diagnose both physical and mental health problems. So, looking at the metaverse for medical training and collaboration, the picture you see on the screen there is not a medical application, but I'm sure you can make the transition from the application to the medical world. This is a metaverse called Second Life. What you see on the screen is my avatar in Second Life, and this is going back some 16 years. And I'm looking at a globe, and the globe is showing me the real the ocean temperatures in real time, and it's the same kind of chart flattened out that I'm standing on. And around the world, around the room, there are other screens showing real-time data about different aspects about the world's environment. So this example connects real-world data into this virtual world, and it means that I can meet with other scientists in this metaverse space and look and share and talk about the same data. So you can imagine the same kind of thing in the medical sciences profession, where instead of the globe you see in the screen, you actually see a human body, and around the room you can see different screens showing real world data about the condition of that human body, and the medical professionals can be in that same space, looking at the same information, exploring it, discussing it in this virtual world environment. It doesn't have to be with a virtual reality headset. This can be on a computer screen, and the people who are sharing this information and discussing it can be anywhere in the world. This is, I think, a great example of how the metaverse has helped with the physical and mental health of a young man with cerebral palsy. I came across this young man over 20 years ago, and it was through one of my newsletters that this young man called Simon Stevens heard about this metaverse called Second Life. Now, he suffers from cerebral palsy. As you can see, he wears a skull cap, but he's very good with a computer mouse and with a keyboard. In fact, he's more skilled and more capable with the keyboard and the mouse than I am or ever will be. So he wasn't hindered there. So when he heard about Second Life, he decided to create his own virtual nightclub. He created a virtual nightclub called Wheelies, and you see on the second on the screen on the left what Wheelies looked like. And his idea was that he wanted to give people an experience of what it was like to have cerebral palsy and be in a wheelchair. So he organised these virtual events called Rolling Mondays. And in order for people to join in from anywhere in the world, they have to have their avatar in a wheelchair to experience what he experiences. And he created all of this. He was completely self-taught, self-trained, and he became an international celebrity. He had Russian television, he had Canadian television interviewing him, and he won a number of awards for his entrepreneurship. So the metaverse, in his case, was extremely empowering. It took the skills he already had, removed the physical limitations of his cerebral palsy, and allowed him to enter into this world that he could be on a level playing ground with other people. One of the ironies of this example, and I'll show on the screen on the left-hand side, was the fact that Simon was one of the project team that I put together for the Serious Games Institute. And one day, because none of the participants could get to the Serious Games Institute for a project meeting, we decided that we would hold the project meeting in the metaverse, in Second Life. So on the left-hand side, you can see me, the back view of me, my avatar, sat in the chair as chairman, and you can see around the board table, there are avatars of members of the project team. And some of them are human, and some of them, as you can see, one of them is a fox. That is how he chose to represent his avatar. Well, we organised this meeting in Second Life, and because Simon Stevens was one of our project team, and we didn't want to disadvantage him by using speech, because his main problem was he had a serious speech defect. You could barely understand him. Even if you were looking at his face, it was difficult to understand what he was saying. So we decided that we would use text chat. So we will put our questions, our comments, our progress into text chat. And Simon was at least as swift at doing it as anybody. And it was one of the most successful project meetings I've ever been into. Because apart from the fact that it was a level playing field, it meant that we had a complete record of what we discussed in the text chat. So we didn't need to make any special minutes after the event. They were all recorded during this meeting. And the irony of this project was that when Second Life became enhanced by voice over IP, which means that you didn't just communicate via text, you could also speak, your avatar could speak. Suddenly, Simon was disadvantaged again. Even though this was technological advance, because a lot of people started using voice to talk to each other, the avatars, Simon was at a disadvantage because nobody could understand him. So that was just an interesting revelation about sometimes how technological advancements can prove a disadvantage to certain groups and types of people. So Wheelies was extremely successful, and he organised these events, and it delivered both physical and mental empowerment in a range of different ways, and so on. This is what Simon said about his dance club in Second Life. It was a fun support centre for those people with disability issues. It was a level playing ground for people with different disabilities. They could choose avatars which were disabled, or they could choose avatars that were not disabled. Some people chose to walk, some people chose to dance, some people chose to fly. And it was the metaverse that empowered them to do all of these things which they couldn't necessarily do in the physical world. Snow World, this is an example of how we use the metaverse. Again, medical sciences are relevant to this, is because certain types of treatments are extremely painful and extremely distressing. And one of those is changing dressings for people with severe burns. So there was a project which involved military personnel who'd been involved in serious accidents with severe burns. And they wanted to see whether virtual reality could be used as a therapy to help manage the pain when people were having their burns, their dressings changed. And so a game was developed which involved knocking snowmen over with snowballs, using a virtual reality headset and listening to Simon and Garfunkel in the headphones. And whilst they were doing this experiment, they put on sensors on the person's head to monitor the pain thresholds that people were experiencing. And so they did this controlled trial that illustrated very clearly that virtual reality with therapies like Snow World, games that were distracting, provided significant pain release for patients with severe burns. And it's not necessarily, you don't necessarily have a virtual reality headset. Sometimes putting a face mask on and putting earphones, playing soothing music or different kinds of music can act as a distractor and reduce the pain that people experience when they're having clinical treatment. Remission was an example of a video game that was designed to help young children with cancer. And the idea behind Remission was that children would play this video game once they were in the hospital world, and the video game involved zapping or killing cancer cells in a video game type environment. And what they did in this clinical trial was to see whether the children who played this video game had improved cancer outcomes compared to young children who didn't play the video game. And the results of this clinical trial indicated that the children who played this immersive video game had improved outcomes from their cancer treatment. And there could be many reasons behind this. One is the kind of distraction therapy that's used in Snow World. That's another reason that it was distracting people from their trouble. But the other reason is that when the children were playing the games, they felt that they had more control over the cancer. They were killing the cancer cells that were hurting them. And that had a positive, both physical and mental effect on the children. They gave them a feeling of more control over their medical condition. Alcove VR is something that I use, and this is a screenshot example of it's a metaverse environment which was developed by the American Association for Retired People. And it's a space that people can personalize with their own pictures and video content. So this is my apartment in Alcove VR. And what you see on the screens, the photographs you see on the screens are my photographs from my life. So in the left-hand side, you can see a picture of me when I was acting on stage in a play. And to the right of that, there is a football team, and that is a picture of me when I was a teenager playing for my local town. And above that, there are pictures of me in a scout troop. And all around the walls, there are my pictures. And so everyone can have their own personalized apartment that they can invite people to and share that experience. And in this apartment, they are also able to play video games and do other things. So this is a video example of what Alcove VR looks like. So this is taking what I could see in my virtual reality headset. So this is my lounge, and I'm looking at the media center. And as I look around the room, you can see the photographs that I showed on the image before. My apartment is personalized. I can navigate around it. There is a games table where I can sit at, and I can play games like chess with other people who join me in the apartment in this metaverse world. I can click on various hotspots to play music. I can decorate my apartment in real time. This is the entertainment screen where with other people like my own family, if they're wearing a VR headset, can join me to watch a movie together. I can also include my own virtual reality content and videos in this environment, which can include entertainment, health and wellness applications, my own VR photos and videos. So if I just click on VR photographs, this shows me some pictures that I've taken with my own camera and drone in some cases, aerial views of places that I've been to, Florence, places around the world, using my 360-degree camera or my drone. So this is actually a drone footage that I took from Florence in Italy. And you can see I flew my drone and you can see the beautiful buildings of Florence. And it means that I don't have to travel. I don't have to get people to come see me. Anybody can visit my apartment that I give permission to, and they can share these experiences with me, just as you're sharing this experience with me now. So you use these little teleporter hotspots to click on, which takes you to that part of the room. And when you get a close-up of the pictures that I was just talking to you about. My football team when I was younger, me at university in the football team, me in various stages. Usually, most of these are when I was a lot younger than I am today. So if I click on here, this shows me in the top right-hand corner of the screen with the moustache pointing at it now. That's me playing for my local football club, Boston United. And you can navigate the room, you can go outside, you can change the scenery, so many different applications that I could show you. It's quite a long video. This is the teleporter taking you outside. At the moment, I'm looking at a snowy landscape, but I could quite easily change that and personalize that to something else. Choose custom scenery. So if I click on one of these things here, it goes suddenly from the mountainside to a meadow. I click on it, and there I'm looking outside at a meadow, and I go around the room. So many different applications. I'm not going to show you them all. I would perhaps move on the video a little way to show you some of the other examples of things that you can do. You can take breathing exercises in virtual reality that give you a beautiful music. This is another part of the apartment. and the scenery is now changed to being seaside. All these different applications are actually free of charge. They're free of charge to have your own apartment. You can share your experience with other people, or you can experience things that other people are sharing with you. So, for example, you can have a diving experience. So you can go and swim with the dolphins if you want to. You just click on what it is you want to do, and there you are. So the metaverse is a place which is unconstrained. These are just some examples of other places that people have posted that you can visit different parts of the world. I showed you Florence. This is somebody else's experience of Florence. And this is Tokyo. This is a video of the busiest traffic junction in the world. So I'm going to move on now from that. So that is Alcove. So these are the kind of features that you get with the metaverse in Alcove. A social meeting space. You can meet with your family and your friends. You can play games together, watch things together. You can watch health-specific videos, create your own personalized content for the room, set relaxing environments, personalize the exterior to the environment, enjoy health-specific applications, which are not only designed to help you relax, but also can help to diagnose conditions like dementia, provides easy access to health information, helps you meditate. All of these things are within one metaverse environment. Now, this is a project that I'm involved in as an advisor. It's called VR to Care, and it explores the potential of the metaverse to support physical activity and rehabilitation in places like care homes. There is a web address that I've shown at the bottom of the screen. And the objectives of VR to Care are to combine the technological advances and the clinical aspect, social perspective of these technologies. So it's an innovative platform, but it's designed also to explore its potential for engaging not just one person, but communities in places like care homes for active and healthy aging with physical activity and exercise. But it's also designed to create this multi-user virtual reality environment in a way that is natural to use, that is pervasive. In other words, it is always on, and there are smart virtual assistants there to help people anytime you go into the metaverse. So it's designed to explore the potential of the metaverse, particularly in the area of elderly care. So it's looking at the level of engagement, effectiveness, and impact that it has on older adults in physical activity, rehabilitation, social interaction, and validate this through small-scale pilots with a community of stakeholders in Europe. And it's designed to be a practical solution that could be rolled out later on. So the virtual reality and the metaverse are having increasing applications within dementia. And there's been quite a number of pilot studies, including some in the UK, locally here, that use immersive experiences with virtual reality headsets to help people with some of the manifestations of dementia. So particularly by providing relaxing environments, providing environments that are familiar to the patient, that help them remember things. But it's also able to provide diagnostic tools And I've used some of these myself to explore the potential of virtual reality and the metaverse. And there's a couple of examples which I think you'll see how they could be used to diagnose dementia. This particular application was a series of games that people could play on their headsets. One of the games was like a fairground game where you had I don't know whether you know whack-a-mole, but it's a game where different creatures pop up and you hit them with your fist or your foot, depending on the system they use. Well, this game used a matrix of 9 circles. So the circles would light up in turn, and the player in this game would have a boxing glove of a certain color. So you might start with a red boxing glove. So the idea was when you're looking at the screen, you're looking at the screen in your VR headset, and if you've got a red boxing glove and you see a red light come on, you punch the red light. If you see a green light come on, you don't punch the green light. And so you can set the parameters of this game to change the speed at which these different lights come on and how long they last for. And so you set the complexity of the game, and by measuring the reaction time of the patient, you can detect whether the patient is showing early signs of dementia, because the reaction times of the patient will slow down if they're beginning to suffer some of these effects. The other game which is played is like the carousel in an airport. You know, when your luggage comes out off the plane and you go to the carousel to pick your luggage up, you obviously have to try to pick up the correct suitcase or luggage of yours. So the way this game works is that you imagine yourself in an airport, and at the beginning of the game, you are shown pictures of different objects that you have to remember. So you might begin the game, start at a simple level where you're shown 3 objects. And what you have to do is look at the carousel, and if one of your objects comes onto the carousel, you have to pick it. And so the objects come round the carousel at increasing speed, and you have to ignore the objects that are not yours and pick the objects that are yours. So you can vary the speed and complexity of the game by giving people more time to remember, more things to remember, increasing the speed of the carousel, etc. But depending upon people's reaction times and the accuracy of what they choose, you're able to make an early diagnosis of dementia over a period of time. The metaverse, I use this myself, can be used for physical exercise. And one of the games that I use is called VZ Fit. And it's an application. You put a virtual reality headset and you can either sit on an exercise bike, or you can actually stand in the room and do exercises yourself. And this can bring motivation to people doing exercise. I'll just show you some brief examples. And once again, I have to make this disclaimer I made at the very beginning. Showing these examples and the ones I've shown you already is not intended in any way to endorse them. I do not have any commercial connection with any of these applications. I'm just showing them as examples. This is another example of VZ Fit.
this account, and now it allows me to carry out exercises. So I'm going to
So here I am stood up in my office.
begin. Okay, been 25 days.
So you see I don't play them that
so
often.
there we go. Right, so I can continue the ride that I was on, and this ride actually was based on my own.
So this is near where I live. So I chose to do this exercise, and what you're seeing now is the street, not too far from where I live. It shows me a heads-up display. It uses Google Street View.
Google Street View.
So I am just standing up and I'm just waving my arms, and I'm riding along this road near where I live. So I will stop that and then move on to other applications. Stress management, this can be used, as I mentioned before, with a 360-degree projector. You can create environments in your own living space or in even bare rooms, even better, that create environments that help you to manage stress. So what has the metaverse got to do with health? As I mentioned before, it creates a space free from the worries of the world, which is very important for some people, particularly in today's world, which is really quite high stress. And in the clinical profession, I know that there are hospitals that actually use these 360-degree environments that people can go into, sit in a chair and experience beautiful music and an environment designed to relax and help you meditate. It's also an environment that we can explore without many constraints of the physical world. So we can do things in the metaverse that we are not able to do in the physical world. And this can be important for our physical and mental health, but it can also be important when the metaverse is being used for medical education and training. It also, importantly, when we're dealing with physical and mental health, it gives us a sense of control and freedom. As you saw with the patients having their dressings changed and managing the pain that this dressing change can cause if you've got serious burn, and with the young cancer patients, giving them a sense of control over the medical condition that has blighted their lives. And same with the cerebral palsy in Simon Stevens. It was enable him to do things and be effectively the same as other people, giving much more control over the world in which he lived. It can help with stress management and mental health issues. As I hope I've shown you, it can also provide you with a space and facilities to exercise. And in the case of Alcove VR, you can use the metaverse, certainly in the aging society, potentially in the future. It could be an important way in which older people can overcome some of the loneliness and social isolation by being able to socialize in this virtual environment. And as I mentioned, finally, it can also help to diagnose both physical and mental health problems and help also with the rehabilitation of some of these problems. So this is the end of the second part of my presentation. So I'd like to open it up to ask if there are any questions at this point. I'm going to stop sharing my screen now. I can always go back to sharing it. So if you have any questions, please pop them into the chat. Okay, so we have one. Yeah, do metaverse review endorse migraine, dizziness, and hallucination? Well, this was a traditional problem with the early virtual reality environments. But the metaverse that I showed you, the very early metaverse on the computer screen, no, there's no way that it could induce that because it was just a computer display. But a virtual reality headset does have some of these problems that can affect people in different ways, which can include migraine, it can include dizziness. I'm not sure about hallucinations. In a way, virtual reality environment is if it's very kind of futuristic, can be similar to what you might find as an hallucination, but some of these environments are designed to be specifically relaxing. So you may see an environment which might be something that could be induced by an hallucination, but if it's properly controlled and managed. Low vision patients. Well, yes, this is can be a problem, but there are solutions actually that not only help people to understand some of the conditions, some of the effects of low vision. I mean, people can have different visual impairments, and you are able actually to simulate those visual impairments using a virtual reality headset so that doctors and clinicians can understand what it's like for a person with certain visual impairments. Low vision patients, I think that the headsets would need to be adapted. Certainly virtual reality headsets would need to be adapted. For people like myself who have to wear glasses, and it's annoying when the headset takes your glasses off, there are lenses that you can put into these virtual reality headsets that correct for your vision, so you don't have to wear glasses to use them. Well, as far as the metaverse is concerned, the metaverse can be done on a computer screen. So anything that you can use to adapt a computer display or a smartphone display, anything that you can already do to adapt this for low vision patients would also have the same effect for people with low vision. Any other questions? Please feel free to type them in. Any other comments as well? The metaverse free version. Yes, the Alcove is an example of a metaverse free version, but Alcove VR needs a virtual reality headset, so you need to have bought a virtual reality headset to use it. So there are some applications that are free that you can, but you need a virtual reality headset to use them, and these can be used for different types of health issues. I'm not sure about screen-based metaverse that you don't need a VR headset for. I'm not sure about free versions of those. So I would have to check that out because I'm not sure that there are completely free versions of the metaverse, although some of the games like some of the ones that I mentioned, Fortnite, I think some of these may be free, but because I'm not a computer gamer, the only one that I use is Second Life. That is to have your own. I think you can access Second Life free, but if you want to have a piece of property on Second Life, you need to pay a license. So I think Second Life is free to explore, but if you want to have a property that you effectively own, then you need to pay a monthly fee. Any more questions? Well, thank you very much for staying with me throughout this session. I see we still have 44 participants, so I regard that as a positive fact. Although it's true that not everybody necessarily may be at their computer screens. They may have gone off to have a coffee or something. But thank you very much. Thank you very much for the opportunity to speak to you today, and I hope you found it interesting and worthwhile.
Thank you very much, David. Actually, I saw some participants from abroad as well, and I think that it benefit for their experience, and I think they can use some of your idea, some of your slide in their hometown as well. I hope like that. Okay. On behalf of the Sirilat Health Science Education Excellence Center, I would like to thank David John Wortley, FISA again, for your valuable time in sharing your experience with the Faculty of Medicine, Sirilat Hospital, and we do hope to have chance in the future for your cooperation. Please help me show your appreciation by using a thumb up sign from your reaction button, if you can.
Thank you. I'm getting so many thank you messages in the chat box. I do appreciate that.
Yeah,
That's much
that's
appreciated.
Thank you so much. So for participants, please give us your feedback through the links and QR code provided after this. You can join the next hybrid topic of post in medical education on 10 April. That means next week for hybrid learning in medical school. Topic from Lidante Mendoza from Philippines. Silinthorn Room, Cherlem Phaket Building, Faculty of Medicine, Sirilat Hospital. Thanks for today's participation. Hope to see you next week. And according to David's already mentioned about telemedicine, if some of you would like to listen about telemedicine from Japan, we're gonna have another post in medical education on this November 13. The topic is about telemedicine as well. If you would like to join, please keep in touch with us. Okay, and for digital tools, we're gonna have like a one-day training on December 20 this year. Okay, keep in touch with Chi, and thank you very much for today's participation. Thank you very much, David.
Thank you. Just finally, one thing to say is that I will be coming to Thailand next March, maybe coming before, but next March I'll be speaking at a conference in Bangkok on public health. So if there's an opportunity to come and visit you in person and deliver a workshop, I'm more than look forward to hoping to see you all in person sometime. Thank you.
Thank you. And just in case that some of you would like to ask Chi to deliver some kind of the workshop with David, please let us know. Okay, we're gonna check out about the possibility after this.
Thank you. Thank you. Bye-bye.
Thank you,
Bye-bye.
David. Bye bye. Thank you very much. สวัสดีค่ะ